data. Now I'm going to move into a very important topic, and I would like to see what you guys think about this. And I'll be really happy to get some feedback. And all of these is on the YouTube page as well, Muthu Integrative. So the hypothesis that chronic disease is synonymous or leads to immune instability is what we're working on. Certain biological, demographic, phenotypic markers seem to underlie the natural selection of critical and non-critical COVID-19 patients. Disease complex, we know, has three items. Number one, agent, host, and environment, right? And therefore, the difference between these different patients, asymptomatic or symptomatic or critically ill or dead patients, comes from the interaction between the agent, host, and the environment. And therefore, during this epidemic, we have definitely done a good job on trying to fix the agent or trying to figure out the agent and trying to work on the host, which is trying to stay away from the agent. And the environment seems to have automatically tried to make some changes itself. But then there is a little bit more work to be done on the host part of it. And we've also obtained IRB for this entire study, and they actually waived consent because it was more a non-interventional study. So what I'm trying to say is that there is a common raw material for all of the pandemics that we have been seeing. Right now, we have at least 5 to 6 pandemics that are going on. Number one, we've known the cardiac disease, the heart disease pandemic that's been going on for the past 5 to 10 years. And that has become the new normal now because 1,772 patients die every single day from heart disease. And we've moved on. Similarly, cancer, flu every year has slowly started coming down, the number of deaths from flu because of the vaccination. And COVID is no different, right? That's the new kid on the block. What are the leading comorbidities? We know hypertension, diabetes, hyperlipidemia, all these systemic diseases, right? We think hypertension, we think of specializing diseases to certain organ systems. We think COPD is a problem of the lungs, right? And that's where we need to move towards our ancient wisdom. We have to stop decentralizing disease to organ systems, and we have to move to a systemic understanding of disease, of chronic disease. Flu compared to COVID is 10 to 40 times less lethal compared to COVID, at least as of 2020. Not only is there a relationship between comorbidities and COVID, but also in cancer, we know, and from data in London, we have, again, you see, bar number 8, hypertension is the top choice for cancer. And then number 11, COPD is the next top choice for cancer to capture people. Number 3, diabetes, obesity 4. And guess what? No one can eat just one comorbidities. If you have COPD, for instance, 29% of patients, 58% patients had also hypertension. Similarly, all these cancer patients, there is a higher likelihood that they have more than one disease. And that's something that we need to pay attention to, as I'll tell you very briefly. The flu epidemic has been happening alongside this, but much less lethal, but still lethal. 39 million cases, okay? 18 million medical visits, 400,000 hospitalizations, and 24,000 deaths, okay? And you see in this picture here to the right, that in 2017, you see how tall the epidemic was. The black line is the threshold for calling it as an epidemic, and this time, the number of pneumonias and influenza-related mortality has reached about 8%, which is above epidemic threshold. But then later it picked up, skyrocketed because of the pneumonias from the COVID, not from influenza. Okay. Well, again, in flu as well, we know what are all the diseases that are associated with flu-related admissions and comorbidities, right? Cardiovascular, asthma, chronic lung disease, metabolic syndrome, obesity. There's a common pattern here, and that's what I want to talk about. However, you see that there is about 10 to 15% of COVID patients and 7% of flu patients in at least 2020 that did not have a known condition. What does that mean? That's where I come into integrative medicine. There are 6 stages for a disease. I'm not sure if you know about it. All forms of disease or imbalance start from the gut. We have known this for many centuries, but we have not understood it. Balance comes from the 5 natural forces that exist and function within our body, both anatomically as well as physiologically: air, space, fire, water, and earth. And they combine in permutation combinations to form 3 different phenotypes within us. Number 1 is called Vata, V, which is called Vata, and the next is Pitta, and third is Kapha, air and space, fire and water, earth and water. Each of these have certain functions in the body, and their balance stays within the gut. And when they go out of balance, then they start in the gut, accumulate, aggravate, spread, deposit, and localize into other tissues, organ systems before they manifest as disease. So as physicians, we actually see disease in our patients only when they show up to stage 4, 5, and 6, because they are now localizing to symptoms, because they have postponed or not paid attention or respect to the initial stage of symptoms. And I'll tell you some of the examples of those symptoms that are part of stage 1, 2, and 3. Okay, for instance, I'm going to take my example. Each of us has different proportions of these 3 natural compounds. And I happen to be somebody who's predominantly Vata and Pitta. I'll tell you why. So, for instance, air and space functions in our gut and in our lungs and in our brain, for instance, in the form of movement, which is breathing, the peristalsis, moving our thoughts from one thought to another, moving our joints, and the cardiovascular system in the form of movement of blood and blood pressure and so on, right? And when everything is in balance, then you have clarity of thought, control of blood pressure, good bowel movements, and so on. Whereas when out of balance, you can imagine the nature of air and space: dry, cold, moving, right? So you will have symptoms such as dry, rough skin, sensitive digestion, very fluctuant digestion. You delay food for like a few hours during your busy day at work, you will have problems. But we don't pay attention to this, we move on, right? And this accumulates over time, eventually manifesting as disease. A perfect example would be IBS. Constipation, fatigue, tension, headaches, underweight, insomnia. Ask the sleep physicians. They see so many patients who come in for clinic visits with insomnia, and they'll have classic features of not just insomnia, but all of these other phenotypic characteristics. AFib, hypertension classically goes along with this, right? Because everything is very easily mobile and very, very fragile. How can you bring air and space back to balance? Well, trying to stick to schedules, the routine, right? Limit unpredictability. Warm things, because the rule of opposites works here. If you are already too much air and space, which is dry and cold by nature, then you have to move towards things that are opposite to your body constitution, right? Yin and yang, same concepts. Warm foods, soupy liquids, grounded environment, right? Morning meditation, trying to limit rigorous exercise when you are already air and space. Avoid all addictive behaviors, and because these people are usually at risk for innovation, creativity, moving from one place to another. And Audrey Hepburn was apparently a classic phenotype of Vata. Steve Jobs, classic example for a Pitta predominant personality, right? He would, have things the way that he wanted to be, right? And when things are in balance, then such people are amazing physicians, for instance, and amazing leaders. However, when a person is made of Pitta, fire and water, they're already hot. They will not tolerate things that are more heating. So things such as spicy foods, not a great idea, right? And we have to respect our automatic body's intelligence that usually wants us to go towards things that are opposites. We have to pay attention to it. So I'll leave you guys to look into these things at your leisure. And these are always available on my YouTube page, and I'll share the PowerPoint with you guys. But yeah, simple examples for Pitta, right? And flame, when it goes out of balance, is what manifests as inflammation. So autoimmune disease, classic phenotypes would be Pitta predominant. Similarly, all of my asthma patients, they have a combination of first Vata and Kapha, because Kapha is full of earth and water, which is heavy, right? And metabolic syndrome and asthma or atopy allergy goes so well with each other. Sluggish metabolism and all these guys that they need is things that will stimulate them, right? Things that are more stimulating in terms of environment, like action, activity, moving about, things that are spicy, black pepper, things that are, and even adventurous things to watch, music that's upbeat. So those are the things that in the environment that will affect your body constitution. And a part of Ayurvedic assessment also includes pulse exam that confirms all of these findings. In my clinic, one of the important questions that I ask my patients is, how does your poop look like? And we all know about this. The role of stool in microbiome is also being documented in sepsis population. And I have been actually working with the microbiome specialists at Montefiore to try to see if we can study microbiome in our COVID patients to see if there is a potential for compassionate use of fecal transplants in severe comorbid COVID disease or critically ill COVID disease. And this was one of the observational studies that I've been doing with my asthma patients in my clinic, and this has been published for this upcoming American Thoracic Society. And I'm starting to work on a survey monkey that you might get sometime soon, where I'm basically interviewing, you can pass it on to your patients and your other relatives and friends. I'm trying to interview patients and physicians and staff about their lifestyle, their body constitution, and whether they had COVID or not, and etc. Very similar to Indian Ayurvedic medicine is traditional Chinese medicine, Greek, Arabic, European functional medicine. No differences at all. Same six stages of disease, rule of opposites. Paying respect to the biological clock is the crux of this entire talk. And in fact, Nobel Prize has been given to three amazing physicians from 2017 for documenting the evidence behind ancient wisdom in the circadian rhythm, right? And alongside the European medicine, we have two amazing programs that I would like at least one of them, Dr. Thaiss, to see if he can bring over to our Jacobi, which is called the Dean Ornish Lifestyle Program, which is an amazing cardiac rehab program that also includes CBT, psychotherapy, stress, addressing stress, and functional medicine. And Wall's protocol was done on patients with multiple sclerosis, in which and Dr. Walls from University of Iowa was a patient herself of multiple sclerosis. And here I'm referring you to this biological clock, and I would like you to see if you can look into that. This is for nutritionists. If you have any nutritionist friends, kindly pass this on to them. Nutrition should not be based on carbohydrates, proteins, fats. It should be much more personalized than that. It goes down to understanding your body constitution first, and then looking at what are the foods that are supposed to be pacifying or opposing to the nature of your body constitution. For instance, if you are already a lot of air and space, then things that are good for you are sweet, sour, and salty. If you are already a lot of fire, pungent and astringent things such as onion, garlic, spice things are not a great idea. And so is things, watching things, or for example, watching adventure movies for people who are already having too much going on in their life, trying to manage 5-10 things at a time doesn't help them. And this is how lifestyle action, priority of action on choosing your actions is very important in controlling your balance and imbalance. We've seen this in rats very well, and also in human studies, where keeping an intact host circadian clock was followed by detoxification, appropriate detoxification, motility, and environmental sensing that led to good cell growth and DNA repair and metabolic homeostasis. as against an impaired host circadian rhythm like jet lag, shift work, or delaying times of eating just because you are so driven passionately to serve these patients and that they cannot wait 5 extra minutes. That leads to dysbiosis and loss of diurnal rhythmicity, leads to obesity, gluten intolerance, and many more imbalances that just accumulate over time. And unfortunately, the loss of health cannot be realized today. It will take some time, but then still health has to be practiced 1 hour at a time, every single day, almost very similar to practicing a musical instrument. And we know one of the giants in the field of epigenome medicine has given us a beautiful book called Biology of Belief, called Bruce Lipton, and I would like to refer you to. So health is really not a single modality. It comes with a package, right? Vitamin D alone is not going to give you the real deal of fixing heart disease. However, it could potentially add something to the entire package that can still possibly promote immune stability. So adding yoga, adding vitamin D, or exposing to more sunlight, definitely. But it's not just medicines. It's not just herbal supplements. It's not just about moving. It's the entire package. And that's where I come into this particular cycle. This is the crux of the entire talk. Move, digest, and rest. If you keep cycling between these 3 actions, you are highly likely to create a balance between your natural forces. And that's where we need to focus on during these next few weeks as we go towards the second phase of this, or the downward phase of this epidemic. We all of us, during these troubled times, when there is such high workload, we're trying to balance between our ego, our passion towards achieving amazing patient care, and duty towards our home, towards our family, and duty towards our own self-health. And it's important that we try to balance these 3, and then alone can we sustain health ourselves, because we have to be examples ourselves, be the change so that our patients can follow these. Single tasking is something that I've always believed in, because if you are amazing at single tasking, then you will definitely be great at multitasking too. Single tasking, in other words, is called as mindfulness. Try to do one thing at a time. That's when you will feel grounded. Respecting the biological clock, as I said, because pharmacy seems to be driving much of the curriculum these days in medical schools and residence and even fellowships. It's all about clinical trials. We need to spend some time understanding the root cause of disease so that we can actually give the right education to patients, because I think knowledge is the most important thing that patients need from us, right? Lifestyle and nutrition and diet and so on. So as physicians, we have to be very careful to make sure how we prioritize self-help. Similarly, guide our patients also to choose how to prioritize self-help first, and that's the order of preference. Self-help, duty towards your home, duty towards your nation and society, and then eventually comes passion, desires, and addictions and inhibitions. And people who need to move have to move enough. People who need to rest have to rest enough. And that's where the clash comes, when people who need to move are resting more and people who need to rest are moving more. If you try to balance these things, you can strike health. So taking care of oneself is one of the most selfless acts of mankind, and try to see if you can balance more towards duty than desires. So I thank you all for your attention. So I'll go for the take-home points. We looked at manpower, patient flow at NCB, spectrum of VQ mismatch, and I would like to encourage all of you to see if you can start using end-tidal CO2 in your own places to see if it's helpful. Demographic and laboratory features of NCB patients with COVID we saw, and chronic disease in the pandemics. It's just been the old story, but a new phase. Move, digest, rest, single tasking, and I defer you to Muthu Integrative. I want to thank the pillars of NCB, women in medicine. Interestingly, we see that CEO Mrs. Contreras, CMO Dr. Aniago, Chair of Medicine Ramasamy, medicine attendings, ICU Dr. Nalamari, Stokal Pradhan, Dr. Mara. So many women in medicine at NCB have literally helped us have an amazing journey during this COVID pandemic. And I thank all of them for this wonderful support. Thank you for all the men in medicine, such as Steve from respiratory department, surgeons and anesthesia, amazing help, environmental services, cleaning assistants, the prone team, amazing, the Navy, the PT, OT, all of you, you've done an amazing job. Thank you for what you're doing. Thank you for my residents for being what they are. And thank you for this opportunity to answer some questions.
I do have a common question from Dr. Prakriti who says that she is a firm believer in mindfulness, but for many of our patients with stressors are very difficult to deal with such things like food insecurity, poverty, and poor health literacy, mental illness, violence, and disrupted families. How can we incorporate this information into your model of functional medicine?
Yes, definitely the most important risk factor for our patients here in New York City is the continuous need for catching up with their demands, trying to make their ends meet, and that's where they are unable to stop and rest. And the best starting point would be, as at least for us as physicians, to be able to hear them out, listen to them, and actually understand their social life, because that's where disease starts. And when they are given a chance to be heard, then they actually come up with their own solutions to their social problems that eventually leads to the remediation or the therapy that they need towards their physical health problem. So both social problems and physical health problems feed each other, and I think we lose a lot of time in our clinics because of the computer-based processing of medication reconciliation and overloading the clinic panel with so many patients. So we are not able to balance the quality versus quantity of care that we give, and that's where maybe now that we have teleclinic and all that, it's possible that we may have to segregate our visits towards listening to patients and understanding their social life. Even if it's a 2-minute, we can segregate a part of our clinic time to just listening to their social issues, so that automatically we can understand where they're coming from, and then they will themselves have the solution to their problems.
Yes, I completely agree. And I feel like education on nutrition is lacking starting in medical school. And this is an aspect of integrative medicine that I do feel that patients respond to very nicely, because they need to know about what to eat. They're always asking about what foods to eat. And we don't know that much, frankly. And we talk about low carb, probably low sugar, low cholesterol. But what does that mean in your life? So I think if we educated ourselves better, we can educate the patients better.
Absolutely. I think the best way to actually take care of patients is to empower them and feel them and make them feel that they're actually not dependent on us for their health, but actually put the responsibility back to them so that they have the power and they actually become their own doctors. And for that, yeah, you're right. We need to learn and see if we can share the right knowledge. And of course, modern medicine is what is actually helping us document the evidence behind all of these other, we call it complementary and alternative approaches, but they're really becoming part of mainstream. And I have a separate video on YouTube that actually documents the current prevalence of Americans using the so-called alternative or complementary approaches, and you'll be amazed to see the prevalence of usage of complementary medicine and also the amount of money that's being spent on that. So it's important that we as physicians actually get to know what these guys are doing out in the community, because we don't have time to even ask them about what are all the things that they're doing.
I believe your audio is fading a little bit. Just checking with the audience. Any additional questions? Remember, you can also type in the chat box. Well, there were a few comments about that it was a wonderful talk and you will be greatly missed. So I think the consensus is in.
Thank you. It makes a lot of meaning to what I've been doing. And thanks to New York, I don't know where it came from, but New York was the inspiration for me to get into all of these things. Of course, it starts from my own home, my own parents, trying to educate me back from India. And we underestimate all the things that our parents say, but only until it made sense in my own life in the midst of all the busyness.
Okay, thank you. And I understand that Prashant will be forwarding me a copy of the recorded talk for whom might have missed it or want to rehear it. It will be available. Is that correct?
Yeah. Yes, I'll pass it on.
Okay. Okay.
Thank you so much.
Well, thank you very much. I think there are no further questions at this point. Best of luck. Excellent work at NCB. I personally enjoyed working with you as well.
Thank you. Likewise.
Okay.
Bye-bye.
Thank you.
Yeah.